Good afternoon to all of you. I am going to talk about something which is not only ophthalmology, because at Center for Sight, we don't believe in treating the eye. We treat the person or the patient. So it is not only that the disease is restricted to ophthalmology, or if a person has the disease, it will not come on into the eye. So there is a very intricate interaction between the eye and the whole body. And sometimes diseases get reflected in other organs of the body, and that is what we are going to look at today. As Dr. Charu had clearly and very lucidly told that 75% of our sensations come through the eyes, and an equally important and large part of the brain is required to deal with this information. So it stands to reason that whenever there is any occupation, most of the occupations are either visual or visuocerebral. I mean, they require the use of eyes for you to fulfill your occupation or any person to indulge in his occupation. So that is why we are going to talk about this topic. A disclosure from my side that all the photographs that I have used in these presentations are with the explicit permission of the patients, because they're generally kids and their parents. Okay, so like I said, that the eye is a culmination of a lot of data which it is collecting and sending to the brain. Now, sometimes, like in any electronic equipment, this data gets warped, this data gets misrepresented, this data gets corrupted. And that is what leads to the play between the mind and the eye. Eye is called as a sounding board of the trivials of the whole existence or persona. So whatever happens in the eye, in the body, is reflected through the eye. We will be talking about these 5 topics mainly, because I thought they were the most important ones, though we will be just skimming the surface rather than diving deep, because the time does not permit that. My child will not wear glasses. Reaction to loss of sight, how does the person react when he loses his sight? Oedipism, and then malingering and non-organic visual loss, and the eye at work, which is most relevant to the audience here. Now, this is a very common statement which we hear. My child will not wear glasses. This statement can be said in 2 ways. My child will not wear glasses. That means I will not allow my child to wear glasses. And the second is that I am helpless. My child does not wear glasses. I want him to wear glasses, but he does not wear them. And most of the time we put the blame on the child and his environment. But sometimes what happens is that it is we who have made it as a monster. It is we who have made it as a taboo. And this is the reaction of a normal mother when she comes to know that her child has got glasses. Be it absolutely educated or be it an illiterate mother, the mother always reacts the same way, what I have seen in my practice. So this is reflected onto the kid also. But sometimes what happens is that the kids are prescribed glasses which are not correct for them. Either they are too big, sorry, my apologies. Either they are too big or they are too small, causing discomfort to the kid. And once the kid is uncomfortable, he will not wear those glasses. So we wrongly attribute it to peer pressure, to things like that, but actually it is misfit glasses, as one of my favorite patients, Anjali, has here, which are the cause of this problem of the child not wearing glasses. The side piece, is it well-fitting? Does it fall off very often? Does it come on from the bridge of the nose? All these things sometimes make a difference. And these days with technology, we have got such wonderful glasses for kids with adjustable side pieces, adjustable bridges, so that the kids are comfortable and can wear it during work, during play, skipping, jumping, riding, cycling, everything. So this is what we need to take care of before we blame it onto the mind. But once this is taken care of, I'll tell you a short story. This girl, Nitya, was prescribed glasses. And she started wearing glasses very comfortably. One day there was a parent-teacher meeting when the parents met the teacher, and they kept discussing. There were less parents waiting, so they got into a conversation, and finally it dawned that the child was not wearing glasses in the school. She used to go from home, reach the bus stop, board the bus, and in the bus she would take off her glasses and put them in the bag. They would stay in the bag. She would attend school, attend her classes, and then on the way back, she would take out the glasses from her bag just 2 stops before her stop for getting down came, and wear the glasses. So the mother was under the impression that the child is wearing glasses throughout, whereas She was not wearing glasses. What was the reason for that? The reason could be any of these reasons, which I have found out in my practice. Either it could be that she was in a minority. There were just a couple of kids wearing glasses in the class, so she felt in a minority. Majority of the people were not wearing glasses. And I see a lot of nodding heads, especially people wearing glasses, so I'm sure I'm relating to you on this. We have made it as a tragedy. We have made wearing glasses as something which is a catastrophe which has befallen on us. And that is why the kid, that, like I told you, gets reflected onto the kid. Peer pressure, teasing, bullying. Believe me, kids can be very cruel. I remember my days at school when we used to use terms like battery, chokha. I'm sure I can relate to you on that, but this is something which is a very normal phenomenon which goes on in schools even today. Okay? So this is what prevents the child from wearing glasses. And last but not the least is that the parents use it as a punching bag. The moment you tell a parent that your child needs glasses, the first thing they tell you is, डॉक्टर साहब इसको बोल दो कि मोबाइल कम देखेगा. डॉक्टर साहब इसको बोलो कि हरी सब्जी खाएगा, ये फ्रूट तो खाता ही नहीं है. I mean, they use it as an excuse to imprison the child. Stop all his TV, stop his mobile totally. That makes him feel that much more, inferior. That he's not normal. Okay? So that also adds to this psyche. What is the solution? That is the problem. We know the problem. What is the solution? First solution is, what we tell our patients is that glasses are not a disease, they are not a disability. They are just a variation of the normal. Like the height of various people varies, everybody can't be of the same height. Same way, the number in people varies. Some people don't have any number, some people have a number which is either plus or minus. So that brings them a sense of normalcy in them, that yes, there is nothing abnormal with me. First thing is that has to be set in the mind of the child. Second is, you have to tell them and offer them hope that yes, once you cross the age of 18, there are technologies available which can take away your glasses forever. That gives him hope for the future. And he wears and persists with the glasses so that his number does not increase, and he is eligible for those treatments when he reaches that age. Let him choose his frame. This is what I have seen works best, because they go in for good, nice looking frames which they feel that suit their eyes, and then this is the look on their face once they wear the glasses, and they continue wearing them. Okay? This was Vayu. Okay, coming to the second part of the topic, reaction to loss of sight. This is something which is really a catastrophe which befalls a person, unlike the first part we discussed. And when this happens, this carries on to the mind because there are two things which are happening. One is the person has lost sight. And second is he has lost his usefulness in the society, whether it was as a family member, whether it was as an earning member, whether it was as a friend, colleague, mother, parent, or a son. So this is what causes this. Let's go a little bit into an interesting history. There was a thing called black patch psychosis. In olden times, what used to happen is that after cataract surgery, both eyes were patched, and the patient was kept like this. On top of this, if patients had hearing disabilities, which generally people do at this age, what used to happen is they used to land up into psychosis, where they used to have fearfulness, where they used to become anxious, where they used to become have hallucinations. So all these things used to happen. And this is the background, but these things are not happening today because cataract surgery is much more advanced, not even a patch is put and you go back with dark glasses. But what is happening is that loss of sight, because of any reason, whether it is an industrial accident or it is a roadside accident or it is because of any disease or pathology, is still a cause for mourning. It is something which involves the whole process of mourning. Now, we all have learned that whenever we have any fatal or a life-threatening disease, there are certain steps in adjusting to it, the emotional steps. And these are the steps which are there in adjusting to it. First, what happens is disbelief. This can't happen to me. ये मेरे साथ नहीं हो सकता. Okay? That is the first thing, disbelief. And then disbelief is taken over by yearning. काश ये मेरे साथ ना हुआ होता. I wish this would have not happened to me. Then comes anger. What have I done wrong? Why did this happen to me? And fourth is depression. When the patient sees that there is no hope, he goes into depression. And finally, if he is able to or she is able to cross these hurdles, comes the process of acceptance. Our job or our responsibility as a family friend and physician is to make sure that the patient reaches the stage of acceptance with the least turmoil. And that is the only way we can help in case there is an irreversible loss of vision. Another interesting phenomenon which occurs in the stage of disbelief is akin to what we have heard as phantom limbs. You all have heard of phantom limbs? When a person has his leg chopped off, he keeps on feeling that the leg is still there. That occurs because of the stimulation of nerves. And something like this also happens in the eyes. After a person has lost total vision, he still keeps telling you, nahi doctor sahab, mere ko dikh raha hai. I can see something. That is actually a phantom phenomena, which is that in that stage of disbelief. Of course, there is a neurological basis also to it, but the psychological basis is the basis of disbelief. In which people is this what do you call, adjustment to loss of vision more traumatic and more difficult? If the age is young, if there is a sudden loss of vision. In case there is a gradual loss, the patient has time to adjust to it. But in case there is a sudden, unexpected loss of vision, that much less time is available. If this injury, it has been seen, happens at workplace, people find it more difficult to adjust because they blame it on the employer. It is because of somebody else's fault. That makes it even more difficult for them to adjust to this. Adjustment is more difficult in males. Ladies are known to be emotionally much more strong, and this applies here also. And in case the patient does not have a good family support, logically, this adjustment becomes that much more difficult. How can we help it? Again, the solution. Psychotherapy forms an important part, and it plays a very, very, very important role in adjusting these people and bringing them back to the society. Family counseling, you don't need to counsel the patient, you need to counsel the family. They don't want pity, they want empathy or interpathy. You have to rehabilitate the patient so that he feels independent and a productive part of the society. And special group meetings where people with similar disabilities meet go a long way in adjusting the patient back to the society. Now this Oedipism, I'm just starting with Oedipism because it is just an anecdote which will lay the ground for the future things. Oedipism, the word comes from a person called Oedipus. He unwillingly killed his father and married his mother. He didn't know about it. And then he was the king of a particular place called Thebes. And this city of Thebes suffered massive health problems and had plague and things like that. So he consulted an oracle or a Jyotshi and asked him, why are these problems occurring? The Jyotshi then finally told him that, look, you've killed your father and you've married your mother. That is why all these problems are occurring. So what he did, he plucked out both his eyes and became a blind beggar as a part of penance. That is from where this word comes. My idea of telling this to you was self-inflicted injury. People inflict injury on themselves. So this was just to lay the ground for that. Another important, or let's say another interesting part in history is Saint Luca's. Saint Luca's is the saint of vision. She is the saint of vision. What happened was she was supposed to get married to a gentleman, and that gentleman was getting betrothed to her, getting married to her because of her beautiful eyes. And she looked lustfully at that person, and then she realized her mistake. And as penance, she plucked out both her eyes and offered it to him and said, now let me be with my God, because she was a saint and pious person. God gave both her eyes back to her, and that is why in paintings you see her with two eyes on the platter and two eyes on her face. So this is just to wake you all up. And coming back to the topic, as far as functional visual loss is concerned, there are various terms which are very confusing. The whole umbrella of terms is called as non-organic visual loss. Why non-organic? Because we can't find any reason for it, any pathology for it, any logical, medical cause for it. So it is non-organic. And visual loss is there because the patient is sustainably telling you that the visual loss is there. Okay? And under this terms comes malingering, when the visual loss is knowingly projected by the patient for some material gains. The important word here is material gains. Hysteria, a visual loss which is projected by the person for emotional gains. Then comes factitious disorder, where there is a slight amount of visual problem which is exaggerated by the patient to gain sympathy, to gain attention. And the fourth is a conversion disorder, where the patient is not aware of or not doing it willfully. He is doing it unknowingly, or that vision loss which is functional is occurring without the patient's active connivance. Okay? This table will make it much more simpler. Malingering, it can be simulation or dissimulation. Dissimulation. Simulation means that I am feigning a disease. कि मेरे को दिखाई नहीं दे रहा है. And dissimulation is that I am saying I can see even though I am not able to see. There are various motives for this. We'll come to them later on. Hysteria in which there is no, hysteria in which there is no actual disease, but there is an emotional gain which is expected, and the patient is aware that he is feigning or he is projecting something which is not there. Factitious disorders, exaggeration. An example of Munchausen, we'll see later on. Whether gains are expected or not is debatable in literature, but yes, the actual disease, some amount of it, actual disease is there, which is exaggerated by the patient. And convergent disorder is something which we need to look at in detail. Now, malingering, what is the motive? The motive for malingering is either compensation, which is applicable industrial scenario, or evading criminal prosecution, avoiding military service duty, which I have seen in my stint with the military, long sailings. I was in the Navy, so just before a 3-month sailing, you used to find people coming to the MI room, what we call as the MI room, or what you call as the dispensary, with various complaints, and a lot of them being ocular, because with eyes, even the doctor doesn't want to take a chance. If there is a slight fever, he'll still say, chal, sailing pe chal, wahan pe theek kar denge. But if the eyes are involved, even the doctor doesn't take a chance. So we used to have a lot of cases like this. And lastly, drugs and shelter. Like, I have got a pain or a disease, and I get cured, but I get addicted to that disease, that drug. If I say that I have become okay, that drug will be withdrawn, but I have become addicted to it. So that is one more motive for malingering or prolonging your illness. These are all pictures of self-inflicted injuries for malingering. These are corneal abrasions which have been caused by fingernails, just to escape a particular court hearing or just to escape a particular duty. This is a picture of a boy who used to constantly put cotton fibers into his lower fornix, willfully, so that he created a cicatricial conjunctivitis and he could avoid going to school. This is the picture of a worker who, if you see clearly, has got a thorn which he has himself put under the conjunctiva, so that it continuously keeps on irritating and gives him a red eye, so that he could escape duties. He was a police person who could escape duties in the outdoors. He wanted a sheltered job. So these are various motives. And another form of this, it manifests in eyebrows. This is a compulsive condition. It is not malingering, but I have brought it here because this also causes physical harm. In this patient, we had a lot of difficulty in diagnosing because in the right eye. Normally it occurs in the left eye because you pluck it with the right hand, but this was a left-handed individual. Okay, coming to what we were talking about earlier, Munchausen syndrome. Now, Munchausen was a fictional character, Baron Munchausen, who was supposed to do very, very, very heroic jobs. He could ride a cannon, he could kill a 100-foot alligator. Basically, it was exaggeration. That is why this name has been associated with this syndrome. And there is another syndrome called Munchausen syndrome by proxy. When you project it onto the others, the mother says that my child is so unwell that he can't even open his eyes. You are projecting your Munchausen syndrome onto your progeny. Another interesting case, this is a 7.5-year-old boy which came to us when I was working with the Air Force. You can see the logo here. His father brought him with a history that he has episodes of bilateral, painless, visual loss in both the eyes, which is gradual and stays for 2 days to 1 week. This had been occurring for the last 6 months, and the frequency had been increasing. We did all the tests possible. We did the optokinetic nystagmus test. We did the Menace test just to see whether he's malingering or not. There was no organic lesion, but we could make out that he's not doing it willfully. So we referred him to a psychiatrist. And what the psychiatrist or the psychologist after sessions found was that there were 3 factors which had occurred in his life in the last 3 months. One was that the family had moved from the village to the city, and he had come and joined a school in the city, which was traumatic for him. He couldn't cope up. Second was a younger sibling had been born. So the attention of the parents had gone on to the sibling, which was causing him that kind of a problem. And third was that he was not able to match up to the kind of lifestyle which his colleagues were used to, or which the other kids were enjoying. So these things the psychologist thought brought on this thing. He underwent psychotherapy, and within 2 months he was seeing full 6x6. So these kind of things happen in us, in our environment, which we don't pinpoint. We point it to organic causes, keep giving them medicines, keep giving them drops and therapy without realizing that there is something else playing over it. But the essentials for diagnosing of a convergent disorder is that exclude neurological disease, exclude feigning. The patient should be doing it unwillingly, then only it is called convergent disorder, and determination of a psychological mechanism. Tips and tricks, I'll just run over it fast because I'm short of time. How can you discern these people from normal people who got diseases? One is in the fields. If you see this, a normal person's field will be funnel shaped. Even if there is a restriction in field, it will be funnel shaped. But in these people, it is tubular. You move the target forward and back, he will only see that much of the area which he can't see because it is tubular. There are tests which are there for total blindness, which include binocular alignment. When you move the eyes both sides, in case both the eyes are seeing, they'll move together. In case one eye is not seeing, it will lag behind. Bar reading test, a person is reading, you put a pencil in front of the seeing eye, which he claims is seeing. The eye which he claims is not seeing will be reading, so he will continue reading. Objective prism test, when the person is reading, put a prism in front of one eye. If he has difficulty, that means there is a problem. And prism stair test. Give a prism to the person and tell him go down the stairs. In case he's actually blind, he'll be able to go down, but in case he's feigning, he'll not be able to go down. Similarly, there are tests for partial blindness of one eye, in which you put convex and concave cylinders and vary their axis to see if the eye is seeing or not. And you have special charts which have minified letters just to see whether the person is feigning or not. In case there is blindness in both eyes, the most important and the most widely used test is what is called as the Menace Test. You suddenly bring your hand in front of the face of the person. He will either blink, and these days it has been seen even if he is expert and he doesn't blink, the pulse rate will go up. So this, the vital parameters, after showing a gory scene or a video which is very gross to the patient, are now being used to detect these malingerers. Another is Schmidt Rimpler test, where you tell a person to put his hand in front of him. A person who's blind will put the hand in front of him and say that my hand is there, but I can't see it. A person who's feigning, he will keep doing like this and tell you I can't put my hand in front. So he will be overdoing things just to convince you. Coming to the eye at work, the important things are fitness to work. The eye has to be fit to work, and there has to be flexibility of employability. If you take a person who is not fully fit, you will not have the flexibility of employing him in various positions. Like some people you will be able to employ for a particular job, but in another job which requires better visual acuity, you will not be able to employ him. So that restricts that ties your hands down. Malingering needs to be taken care of. Like I told you, reverse malingering is something where the patient is scared of losing his job. So even if he has a disability, he keeps on saying, I don't have a disability. उसको दिख नहीं रहा है, फिर भी बोलता रहेगा मेरे को सब कुछ दिखता है, because a guard, a security guard or somebody like that, or a driver, even if he can't see, he'll keep telling you I can see, because that is reverse malingering. He doesn't want to lose his job. So all these things have to be kept in mind. And compensation. Now I'll give you a very fine example before we end. This is about the pilots. We used to do the medicals of the pilots, and suddenly we did a study and found that most of the disabilities in pilots used to occur between 54 and 58 years of age. The reason is here. The pilots have what is called as the insurance, which is the insurance for loss of license. In case they lose their flying license, the insurance company gives them a lump sum. So they have got insured at 30 years of age. They are approaching 58 years of age. After they cross the age of 60, this loss of license insurance gets converted into a disability or accident insurance. If they avail it before that, they get the full lump sum. If they cross 60, they will only get accident insurance. So they have lived their flying years. They have done flying for 30 years. Now just before 60, they would claim that they can't see, just to claim this lump sum compensation and then go out with this compensation. So these kind of things do happen in this world only. I'm not saying that everybody does it, but then yes, there are bad fish in the pond. Post-traumatic stress disorder is another thing, which is ocular manifestations of which are being seen every day, in and out. And with this, I end my talk. Thank you so very much.